Psychosis isn't a diagnosis, rather it's when the brain's reality filter stops working and the mind starts to treat misinformation as fact. So the word psychosis can be broken into two parts. Psych meaning mind, osis meaning a disordered process or condition. Now it's not a disease, rather psychosis is a syndrome where we see clusters of symptoms. Symptoms like hallucinations, delusion, disordered behaviours, changes in emotions, changes in behaviours. Now this can be associated with other conditions and they can be psychiatric such as schizophrenia or certain affective disorders like bipolar or depression. It can be also associated with substance use, both in its active use or during the substance withdrawal, and other medical conditions. Now when we look at psychosis and the symptoms can be broken into two groups. One group is what we call positive symptoms, and this is where we see new things that comes into people's lives, such as hallucinations, which is seeing or hearing things that aren't there, delusions, that's fixed beliefs, or disordered thinking and behaviours. Whereas negative symptoms is where we see a drop in normal function. We see blunted emotions, decrease in motivations, and social withdrawal. Now, a theory that tries to explain how psychosis may develop in the brain comes down to a neurotransmitter called dopamine. So the theory suggests that in different neural networks in the brain, there may be situations where dopamine might be used too much, and that could explain the positive symptoms, and other neural networks where there may be not enough dopamine. So the treatment looks at trying to re-establish the dopamine dysfunction. And this can be through things like medications like antipsychotic medication, psychological therapies, social, sleeping, and substance support. The good news is psychosis is treatable and many people do get well, especially with early support.